My name is Dr. Benard Munyao. I'm a paediatrician. I work at Taita Taveta County. I'm also CEBA County focal person and Capricorn focal person. Before we had this data, we were not able to implement many things. But through the work of advocacy and using data that we managed to get from KDHS that was brought in by Capricorn, and the fact sheets that were presented, then we started seeing where our weakest points are and call of action. So actually using that data, we were able to see we have a problem, for example, in stunting rates. We have a problem in food security. We also had another problem with the antenatal visit, the fourth antenatal visit. So we sat down and we had to do something, take into action where we got these weak points. So far we've managed to make certain strides, I can say. For example, in matters food security, we were able to do a World Hunger Day in the year 2023. And what drove us to commemorate this day was because our food security was at stake and the stunting rates were high for Taita Taveta. Then we sat down and asked ourselves, how do we commemorate this day? And from this day, if we commemorate it, how can we come up with a plan or a policy that we will use to make sure that we are not in food security issues. We don't have food security issues. So we called into the board, member of CEC, member of agriculture, CCM member of health, CCM member of environment, CCM member of education. So as we laid down the strategies, we decided to come up with a policy. And the policy, we called it Agri-Nutrition Plan for Taita Taveta. This policy was actually implemented in the next year. So using this policy, we came up with certain points. And these points were, one, we asked ourselves, this area of Taita Taveta is a semi-arid area. And the foods that the locals grow, most of the time they don't harvest. So we had to come up with a plan of how do we get drought-resistant foods. That was the first question we asked. So with the help of the Ministry of Agriculture, we came up with food-resistant crops like pigeon peas, beans. Then we also added value. We did value addition for our foods. We have an area in Taveta that is very rich in, when you grow bananas, they do very well. So we actually decided to make these bananas. We decided to export them and send them locally. And the amount of money that we generate, we use this money to boost other things like the livestock. That we did that to improve the value chain. Another immense stride that we made was in terms of initially FIF we were doing poorly. Facility Improvement Fund. It was, I think, at 30% before we got the data, but currently we have implemented it. We are doing 75%, with the remaining percentage being used to cater for the local casual workers. So it was a big stride for us. Another reflection that I got was we had frequent stockouts in our hospitals. But currently, with the FIF and its implementation, we do get stockouts, yes, but they are not as severe as we used to have the years before. So we have done immense. So this role has helped me, one, to link the different departments. While tackling the hunger issues, we decided to get different departments into action. So that role has really helped me to coordinate and to bring different departments together. We even managed to get the governor who is in support of what we are doing. So it was a big role. So key successes. One was ability to use our own data. We didn't have our own data, but now we use our own data to make our own decision, and the decision that affected local person. So that was a very key important thing that I learned and that we achieved. Number 2, I learned that if you have a problem, don't only get solution there and then, but finding a lasting solution. It was through working with Capricorn, working with the Ministry of Health, working with the local government, working with the county government, that we were able to bring our heads together and be able to come up with a plan that later changed into a policy. So through my advocacy, we got, first of all, the way I said, we got data. Then from that point, we knew that Taita Taveta food security and standing rates were high. So we had to involve different teams. From the involvement of different teams, we got even to the level of finance, and money which was low, which usually was allocated to agriculture, was increased. Currently, agriculture is given 118 million to improve on agriculture. One, I wasn't able to visit the governor or even the ministers of different departments, but currently I can talk freely to either of them. I can share the data that we have to either of them freely without having to strain. Even the professional association, actually I knew the members and I've known the president, so it's very easy to approach them in case we need any support. I'm a doctor, so my work was just confined to a room with patients. I didn't know about advocacy. I couldn't do advocacy. Currently, I can run an advocacy very well. I know which areas to use when I want to achieve something. Then another thing, it's very easy to link the right person or the right leader to, let's say, to support you when you are doing an advocacy project. Some of the lessons I will carry past this project are: 1, use of data; 2, solution, permanent solution to a problem; 3, advocacy. Future champions of health advocacy, I would like to tell you this, that once you use your advocacy skills and you use your data very well and you present to the right people, you will get the results. So you never give up. Just use data, continue using data, and use that evidence to convince policymakers and the lawmakers. I'm very grateful to the County of Taita Taveta, very grateful to Capricorn as a stakeholder, as a team member, very grateful to the Ministry of Health. It has really supported us in many things. Very grateful to my CEC Health, CEC Agriculture, and other CECs who have supported us in different aspects. Very grateful to the focal person that we work with in the reproductive health and entire Taita Taveta County.